Okay, continuing on with contraception, this is Dr. Hall. Let's assume that either you forgot to take your pills or the condom broke and you're stuck because you just had sex and you're worried you're at risk for pregnancy. This is where emergency contraception comes in. So emergency contraception is medications or devices that can be used after intercourse has already occurred, right? So either no condom or other form of birth control was used, or it was used improperly, or it failed, right? So this is after the fact, something that you can do to decrease the risk of pregnancy. We have three basic options. Two are oral pills, tablets that you can take and swallow. One is over the counter, the other is by prescription. Or you can also use the copper IUD, which we've already talked about this lecture. So I just want to highlight that these are not medications that cause an abortion. So these are not abortion pills. They do not harm an already established pregnancy. They prevent a pregnancy from occurring, usually by preventing fertilization. And we'll talk about the times that there might be a little bit of a gray line there. We'll talk about that. So Plan B, which is levonorgestrel, a progestin, was one of the first emergency contraceptives to be marketed that way. And it's a progestin. You can take it up to 72 hours after unprotected intercourse, but the sooner the better. It's going to be much more effective if you take it as soon as possible. And it can delay the likelihood of your pregnancy by as much as 80%. So if you had a risk of pregnancy of 10% based on where you were at in your cycle, your risk then can go down to 2% overall risk of pregnancy. How does it work? So it actually works by delaying ovulation. So basically, if you were at risk for getting pregnant, that's because you were about to ovulate. Remember, optimal timing to get pregnant is to have sex shortly before you ovulate. So what levonorgestrel does is it basically tells the ovary, wait, and holds on to that oocyte and prevents it from being released, right? So this is interfering with that positive feedback loop between LH and estrogen that usually results in ovulation. This interferes with that so that the oocyte is held on to for a couple more days, giving an opportunity for the sperm that are present in the female reproductive tract to die off, get weak, become poor swimmers, right? So that they are less likely to be capable of fertilizing the egg. A really important thing to know is if you already have a fertilized egg, if you already have an established pregnancy, it will not interfere with that. Because it's a decent dose of a progestin, and progestins, when you have a high dose and then it comes down and it wears off, can cause endometrial shedding. You can get some irregular bleeding after taking Plan B. If you were taking some other form of birth control like pills or something like that, you should keep taking those as scheduled, even if you get a period when you weren't expecting it after taking Plan B. So just keep on keeping on. And then if you don't get a period when you were supposed to get a period, you should check a pregnancy test, right? This is not a 100% prevention of pregnancy. But it can be very highly effective in significantly reducing your risk of pregnancy after an episode of unprotected intercourse. The other oral emergency contraceptive is marketed in this country as Ella. The active ingredient is ulipristal acetate. Well, that's a weird medicine. We haven't heard of that one before. This medication is strange because in the body it acts both like progesterone and like an anti-progesterone. It depends on the tissues. Now, because of its mechanism of action, this medicine can be taken up to 5 days after unprotected intercourse. It will still help reduce your likelihood of pregnancy. Again, overall, it can reduce the risk by up to 80%. Again, this medicine also delays ovulation, and Ella is able to delay ovulation for 3 to 5 or sometimes even more days, whereas Plan B can delay ovulation usually for 2 days, giving some time for sperm to die off. Ella can delay ovulation in many studies by 4, 5, 6 days even. So really giving time for the sperm to die off before the oocyte is released. And that's part of why it has a little bit broader indication. It's a little bit more useful. There's some suggestion that it may impair implantation of a fertilized egg because of its anti-progesterone-like effects. So if an egg has been fertilized but not yet implanted, which as we know happens around day 8 after fertilization, then it may impair implantation of a fertilized egg. That's a little hard, tricky to study, so we don't have clear data on that yet. If implantation has already occurred, it will not affect an already established pregnancy, right? So depending on when you consider a fertilized egg a pregnancy, you might say that Ella can or cannot cause an abortion depending on what you define as a pregnancy. Is a fertilized egg a pregnancy, or is an implanted blastocyst a pregnancy, right? It depends on how you do your definitions. This one can also cause irregular bleeding. Same kind of thing, so don't worry if that happens. It also seems to be more effective than Plan B in people who are over 165 pounds, which is about half of the population. So a lot of people are probably a little bit better off choosing Ella or ulipristal than Plan B. The trick is that this one you need a prescription for, so you need to get it from the clinic. The other trick about Ella is because it acts also like an anti-progesterone. It can interfere with the action of your birth control, and in fact, birth control, this was just recently demonstrated this past year, can interfere with the effectiveness of Ella. Now, if you were taking your hormonal contraceptive regularly, then you didn't need to use Ella in the first place. And so I'm going to tell you, if you have been using your contraceptive regularly, don't take emergency contraception as like an extra just in case, right? That can cause problems. So that's one of the reasons why this is prescription only. We want to make sure to talk to the person about stopping their birth control for a period of time and using a backup method such as abstinence or condoms, because they are not going to be protected for a while afterward. Again, if you don't get your pregnancy when expected, check a test. This isn't 100%. You can also use the copper IUD as an emergency contraceptive. So as we've talked about before, it's highly toxic to sperm. That's part of how it works to prevent pregnancy in people who are using it as ongoing birth control. But if the oocyte hasn't been released yet, you can put the IUD up in the uterus. It'll zap all the sperm, hopefully before the oocyte is released. The thing about the copper, though, is it's also toxic to the oocyte itself and to a zygote or a fertilized egg. So what this means is, one, you can insert it up to 5 days after intercourse. It is extremely effective at preventing a pregnancy after unprotected intercourse. But it might not be morally or ethically acceptable to folks because of its ability to kind of kill, so to speak, a zygote, right? So it is toxic to a fertilized egg. So depending on when you think a life begins, right, some people will call this abortion and some people will not. But it is the most effective emergency contraceptive available. So if we do a side-by-side comparison, Plan B, which is the levonorgestrel one, is over the counter, which is nice. It makes it really accessible. You can also get it at student health services. We charge a lot less for it than Walmart or Walgreens do. It's only effective for the first 72 hours, and it's probably less effective in people that weigh more than 165 pounds. Overall, your risk of getting pregnant after using Plan B is slightly more than 2%, and it works by delaying ovulation, right? Holding on to that oocyte, giving time for the sperm to die off and get tired out. Now, one thing I do want to say that's really important when we talk about the overall risk of pregnancy, this efficacy data that you see here is looking at using these medications once, right? This is not looking at using it multiple times. So if I have unprotected sex today and use Plan B, and then 3 days from now and use Plan B, and then a couple more days from then and take Plan B, all bets are off. And in fact, there's some evidence to suggest that your risk of pregnancy will increase with repeated taking of this, because it's you're kind of like delaying that ovulation too long. So be really cautious about that. These are meant for kind of one-off use. So Ella, which is ulipristal acetate, you need a prescription for it, but it's effective up to 5 days afterwards, and in people who are bigger body size, probably at least 185 or more pounds. It also delays ovulation, but might possibly inhibit implantation. We're not entirely sure. We think, if anything, that's a secondary mechanism, but again, if there are ethical implications of that for you, you might want to know it. Can cause irregular bleeding, just like Plan B. And then we have the interaction with hormonal contraception, right? So you need to be careful and talk with your provider about that. That's one of the reasons that it's prescription only. A copper IUD you can only get in a medical office. You can't insert those at home, but it's effective up to 5 days after unprotected intercourse, no matter what your body size is, and it's extraordinarily effective, right? Very low risk of pregnancy if inserted within 5 days. It is toxic to the sperm and to the zygote. As we talked about with IUDs, the insertion can be uncomfortable, and if you don't have the family planning only services or insurance, it can be expensive. But a benefit is then you have ongoing, highly effective birth control. So those are our 3 commonly available forms of emergency contraception, which, remember, by definition is not causing an abortion. It's for the most part preventing fertilization and preventing a pregnancy from occurring. So in our next and final installment of this lecture, we're going to talk about sterilization or permanent birth control.